Hello, and thank you for joining the Systems for Action ResProg webinar. My name is Chris Lytle, and I am Deputy Director of Systems for Action. For those who are new to the program, Systems for Action is a national research program of the Robert Wood Johnson Foundation. We support studies across the country, testing tools and models to facilitate multi-sector collaboration across medical, social, and public health systems with the goal of improving population health and advancing health equity. Our ResProg webinar series serves as a platform for S4A investigators to share findings at various stages of their studies and provide commentary on the potential impact of putting their findings into action. Today, we'll hear from Dr. Glenn Mays, who is Director of Systems for Action and also Chair of the Department of Health Systems Management and Policy at Colorado School of Public Health. And he'll be discussing how the Systems for Action Intramural Research Team used data from a national representative survey of more than 600 communities to examine patterns of interaction between local law enforcement, public health, and social service organizations. If you have questions, please enter them in the Q&A box, not the chat box, the Q&A box, and we'll reserve time at the end for your questions. And without further ado, I will pass things along to Dr. Mays to talk about our intramural research.
Fantastic. Thank you, Chris. And thanks everybody for joining us as part of this regularly recurring webinar where you can hear about research that's active and underway and within the S4A program. And as Chris said, today we're going to feature some of the work that we're doing internally from our S4A program office based here at the University of Colorado. And this is in the spirit of the ResProg webinar. We often and really encourage research teams to feature, to share results early on in their research projects with the goal of being able to generate some discussion, some feedback and dialogue among the field that could actually lead to improvements in the research as it continues to be carried out. So in that spirit, I'll be talking today about a very recently launched a new analysis that we have underway. Our Colorado team, again, looking at this interface between law enforcement and public health. I do want to note we've got a number of collaborators who are working with us on this project. Our intramural research team, a stellar team of PhD students working with us, including Micah Hammer, Kelsey Owsley, Dina Barassi, and Taryn Quinlan. And I was also very fortunate to get two of my long-standing collaborators who are at other universities, two other universities, to join us in this collaboration. Dr. Charlotte Smith from University of Kansas and Dr. Michael Preston at VCU. Charlotte and Mike and I have worked together for a long time, going back more than 15 years when we were all together at University of Arkansas. And so we're really fortunate they've agreed to collaborate with us in this initiative. Charlotte in particular is kind of is a growing expert in this area of studying justice-involved populations. She recently has an NIH Award, Career Development Award, that focuses specifically on justice-involved minority women and their navigating health and social systems to improve maternal and child health outcomes. And so Charlotte's expertise, particularly on the justice sector, criminal justice sector, and its interface with health is particularly important for this collaboration. However, what I'll be talking about today is very, very early preliminary analyses that only I can take credit for, both of the findings as well as any of the errors and omissions in today's talk. So please blame me, not my collaborators, for anything that may be missing or may be wrong with what I share with you today. So little bit about the motivation behind this work, as I'm sure all of you can identify with. Our team was really hit it hard in many different ways by the events that have played out over the last month in terms of additional prominent examples of unequal treatment, bias, racism, and violence in the criminal justice sector here in the U.S. I know as these issues has played out across the country, they've forced us to really think carefully about what actions we can take, as a research enterprise to try to make progress toward improving the situation. And as a group of health researchers based here at University of Colorado, we looked around at the activities we had underway and realized that we did have some opportunities for leveraging data and research we had underway to see whether we could shed some additional light, some new light, maybe offer some insight into some possible directions for solving some of these problems of racism and injustice in the criminal justice sector, and importantly, its impact on health and health equity. And part of our motivation here is we looked about these episodes that have played out recently in places like Minneapolis, in places like Kentucky, Louisville, Kentucky. These are actually places where we've been studying health and social service systems in these communities for a long time. And these are places that actually have relatively strong health and social service sectors in places with relatively strong connections between health and social service sectors in these places that nevertheless have experienced really tragic episodes of police-associated violence and unequal treatment. So that, has really motivated our thinking and our desire to see if we could offer, a lens from the multi-sector alignment research, a lens that might provide some insight into why these tragic events continue to happen, even in places with strong health and social service sectors. That led us to at least formulate a hypothesis that maybe there's something about the nature of the relationships between the criminal justice sector and the other sectors and organizations in the health and social sectors that could explain or at least offer some insight into what may be happening there. There is a large body of research on inter-organization relationships generally, and as well as those relationships in the criminal justice sector, and that tell us that these relationships between law enforcement organizations and other types of organizations certainly can exert significant influences on the cultures that exist in those organizations, the policies that are adopted, and ultimately the actions and behaviors that are carried out inside those organizations. So we know that organizational relationships are important determinants, important drivers of institutional culture and behavior. And so perhaps that leads us to this hypothesis that maybe one pathway for improving and supporting more equitable practices in the criminal justice sector may lie in strategies for strengthening the connections between law enforcement and other actors in the community, particularly other organizations in the health and social service sectors that may have expertise, may have tools, may have information and technology that can help law enforcement build cultures and practices that promote health and safety and social justice. So that's at least the hypothesis that we want to begin to explore with the lens and with the data that we have available to us. I do want to say that we'll be talking about this intramural research study today, but if we look at the larger Systems for Action program, we have a growing portfolio and quite heterogeneous portfolio of studies looking at system alignment strategies that involve the criminal justice sector. So this we already in the S4A program, again, have a number of studies that are looking at these issues from several, from a number of different perspectives, and that are testing system alignment mechanisms that involve the criminal justice sector and that are attempting to bring criminal justice actors into greater alignment and collaboration with other sectors. And so 5 of the studies I just pulled out today are on this slide. A couple of these, Michigan and Delaware, have already completed. So you can go on the website and actually pull down results from these studies, looking at the complex care response teams in Michigan, focused on preventing elder abuse that involve law enforcement and other organizations, or the multi-sector support teams tested in Delaware that were implemented within county probation offices to help address health and social needs of individuals who are in the community corrections system. And then a number of other studies are still underway, but are beginning to produce preliminary findings. And you'll see these research teams featured periodically on future editions of this webinar as well, including the ASU's Arizona study looking at emergency response systems for persons with serious mental illness. The Texas A&M study looking at the transformative justice program for young adults who are involved in the criminal justice system. And also a study led at Ohio State University looking at the role of regional governing boards in rural areas of the state, designed to align services for children who are in families that are affected by opioid addiction, often with criminal justice involvement. So just to give you a sense of the larger landscape of S4A studies that are looking at testing system alignment strategies that explicitly involve the criminal justice sector. So we're in good company with continuing to explore these issues, which are really at among the issues at the forefront of public discussion and policy debate right now as we speak. Okay. So a lot of our intramural research team based here at the University of Colorado, we've focused heavily on this notion of trying to understand the delivery systems that exist within communities for supporting population health and improvement activities. And we anchor a lot of our research on this definition you see on this slide, given to us by the National Academy of Medicine, kind of what are population health improvement activities and what are the delivery systems that we need to support those activities. And importantly, that last bullet of the slide emphasizes the fact that these activities designed to improve health on a population-wide basis really depend essentially on collective actions of multiple organizations and sectors, coordinating efforts to implement strategies that can monitor and improve health on a population-wide basis. And so that's really been that's the key organizing theme of the research that we lead within the intramural research team at our Colorado-based team, really understanding the systems or the networks that exist within communities to support coordinated, collaborative activities around population health improvement. For this particular study, looking at law enforcement engagement in these multi-sector networks, these are the questions that we hope to answer over the course of this research project. The first 2 questions are ones I'll share with you some evidence on today. The second 2 questions are things we hope to get to shortly, later on in the course of the study. But today, just starting with the descriptive epidemiology, if you will, understanding variation. To what extent are law enforcement agencies engaged in community-based networks that are working on health improvement activities at the local level? How does that vary across the country? How does that vary across communities? Variation in terms of the types of organizations that law enforcement agencies are collaborating with to implement health improvement activities, and also the specific types of health improvement activities that law enforcement agencies are engaged in these communities with other actors in the system. Understanding, as we often do as a first stage of a health services research project, how much variation is there? What's the nature of that variation and then what can we learn from that variation ultimately in terms of the correlates, the causes, and the consequences of that variation. So I'll answer these first two, quickly share with you some preliminary evidence on these first two questions here shortly. The next two questions are things that we hope to get to. We are designing a study with the ability to ultimately look at change over time, how law enforcement engagement in multi-sector community health networks are changing over time, and potentially in response to the events that we all have been living through over the last month, in response to protests and civil unrest around criminal justice activities, and potentially change in response to the reforms that we're beginning to see designed and implemented across, for law enforcement agencies at both state and local levels. And then finally, we ultimately want to be able to explore whether law enforcement engagement in multi-sector health improvement networks, whether that ultimately is able to influence law enforcement behavior or policy or practice in any important way. And starting by looking at two important signals of law enforcement behavior. One is incarceration patterns and levels, and second are measures of police-involved deaths. Let us test the hypothesis. Do places where law enforcement agencies are more engaged in multi-sector networks around health improvement, does that lead to less instance of harmful law enforcement behavior and events in terms of incarcerations or deaths? So what are we using for this work? Well, as I mentioned, a lot of our intramural research based at Colorado centers on a longitudinal survey of communities that we've been conducting now for over 20 years, the National Longitudinal Survey of Public Health Systems, survey that we originally started with CDC support way back in 1998 and have maintained more recently with support from the Robert Wood Johnson Foundation. The survey follows now a nationally representative cohort of about 600 communities across the U.S., both urban and rural communities. We follow these communities over time by periodically surveying representatives in these communities, asking them about a range of population health activities, whether or not each of these activities are implemented in the community. And then the survey also asks about the range of organizations that help to implement these health improvement activities in each community, giving us information about the structure of the network that exists, the organizations that are working together to implement health improvement activities. In this survey I mentioned, originally designed and launched with CDC support, the activities that we measure on this survey generally are population health activities that have been widely recommended based on research and experience for their ability to support collaborative efforts around measuring and improving health at the population level. So that these activities are based originally on recommendations of the National Academy of Medicine, formerly the Institute of Medicine, in their several reports in making recommendations about strategies for improving population health. They also align well with more recent national guidelines and recommendations of the HHS Public Health 3.0 framework, the Public Health Accreditation Board standards for state and local public health agencies, as well as other national recommendations. So by collecting these data periodically, and now we conduct the survey every 2 years, again on this national cohort of communities, that gives us the ability to look pretty broadly at variation and change in the structure of local networks that exist, organizations working together to implement nationally recommended health improvement activities. We can look at how they vary across the country, how they change over time, and then by linking these data with other sources, we can study the causes and the consequences of change in network structure and composition, the structure of networks that support population health improvement activities. Importantly, in just back 2 years ago, the 2018 survey, we added some additional detail to the survey that for the first time let us measure the extent to which law enforcement agencies were engaged in helping to implement these activities in their communities. And so, unfortunately, we don't have law enforcement data going back 20 years to the 1998 survey, but we do have data, at least baseline data on law enforcement engagement in these networks in 2018, and we'll be fielding the 2020 version of this survey actually starting next month through the end of 2020. And so we will shortly have at least 2 time periods in which to look at law enforcement engagement in these networks, changes over time, variation across 600 communities, and time periods that also, fortunately for us, span the period before and after this heightened public and policy attention to law enforcement inequities. Okay. Just a little bit, I won't go into great detail about the specific activities measured on the survey, but just again, as I mentioned, these are activities that are based on recommendations from the National Academy of Medicine, strategies that have been found to be effective in supporting community-wide engagement and health improvement activities. They include, the things that we measure on the survey include strategies for engaging stakeholders in health assessment and planning activities. They include measures of extent to which health needs assessment and risks assessments are conducted periodically in the communities, strategies around planning and priority setting around in the community around which health needs should receive priority, strategies around committing shared resources to defined health priorities in the communities, the extent to which resource sharing is occurring, as well as activities that are measured around monitoring and evaluating the impact of collaborative health improvement activities. So the 20 specific population health activities we measure on the survey are based on these 7 that are now called foundational capabilities in population health. So we can measure the extent to which each of those activities are done in each community, and as well as which organizations help to do them. As I mentioned, we can then take our survey and link it with lots of other existing data sources to conduct studies that help us understand the causes and the consequences of changes in the networks that exist at the local level supporting these population health activities. These are just some of the data sources, national data sources we've linked up with our survey data over time to conduct these kinds of studies. And most recently at the bottom, you see that we are now in the process of bringing in 2 additional data sources that help us look specifically at law enforcement dynamics and law enforcement behaviors that could plausibly be linked to the networks that we're studying here. So we're specifically bringing in data on county level incarceration rates from the Vera Institute of Justice, and then bringing in data on police-involved deaths from a couple of different data sources. One, a CDC data source, National Violent Death Reporting System, and then secondly, a kind of a crowdsourced data source, the Mapping Police Violence data source as well. And obviously, both of these issues we're trying to measure with these new data sources certainly have a long history of presenting methodological and measurement challenges in terms of, in particular, underreporting of police-involved violence and police-involved deaths. So we're just now in the process of doing those data linkages, so I won't be sharing with you today results on those outcomes, but more focusing on the first stage issues of understanding variation in law enforcement engagement in these local multi-sector networks. Just a quick note on our methodology for how we measure the structure of multi-sector community health networks at the local level. We do bring in some techniques from network analysis to help us measure network structure in this context. As I mentioned, our survey contains, there are a total of 20 population health activities on the survey. We ask in each community whether or not each activity is performed in that community or has been performed in the last 3 years. And then we measure, for those activities that are performed, we measure the range of organizations that help to implement those activities in the community. So that gives us, in matrix notation, a two-mode matrix or a two-mode network. We can look at activities 1 through 20 on the, which are the columns, cross-referenced with the organization, the range of organizations that we asked about that may or may not contribute to each of those activities. So we have organizations linked with activities in a network analysis terminology. That's a two-mode network. We then can transform this two-mode network into a traditional one-mode network, which is what is commonly used for network analysis, by looking at each pair of organizations or each pair of sectors in our data and counting up the number of activities that are jointly contributed by that pair of sectors. And that number of activities that are jointly contributed by each pair of organizations is our measure of connectivity between those two sectors. In terms of that's how we measure the degree of connectivity between those two, that dyad, those two pairs of organizations. And that's essentially how we basically are able to construct a network for each community in each year of our survey. And so our survey becomes a massive surveillance system. Then we are tracking more than 600 networks across the country and measuring them every 2 years, so we can study how each of those 600 networks changes in structure and composition over time. Obviously, for this analysis, we're particularly focused on the law enforcement sector, and that's understanding that sector, the degree to which it works with other sectors and implementing these recommended activities that are measured on the survey. So we're focusing in on the dyads, the network dyads that involve law enforcement working with other organizations and sectors in the community to implement these recommended activities. So we can generate, those of you who are familiar with network analysis, I know that many of our colleagues in the S4A program use similar and some of these same methods. We can generate network diagrams like the ones shown here for each of the communities covered in our survey for each time period every 2 years that we generate our survey. These allow us to visualize the structure of the local network that's supporting population health activities in these communities. The size of the boxes, the nodes that you see there, generally are scaled based on the degree centrality that is measured in the network, a measure of how important or influential each organization or sector is in the network, and the thickness of the lines connecting each pair of organizations or sectors is a measure of tie strength, or the degree to which these pairs of organizations are, how strongly connected they are. In the context of our study, that is scaled based on how many of these recommended activities are jointly contributed by each pair of organizations. So again, for this analysis, we're particularly interested in in the box that represents the law enforcement sector. How large is that box? How influential is that sector in the overall network in terms of supporting population health activities? And how thick are the lines connecting law enforcement agencies with other organizations in the community? Because that tells us again how connected law enforcement is to these other sectors in the context of implementing population health activities. So I'll show you some of these metrics here in a bit. Just a quick note that we've used these same data and these same methods for a variety of other studies to evaluate how the role that multi-sector networks play in improving health and addressing other issues in communities. This is a slide from a study published a few years ago where we used longitudinal data to show places that had stronger multi-sector networks over time achieved larger reductions in preventable mortality over a period of time, large and significant reductions in mortality, showing that networks really do have there are tangible health effects that we can attribute to the strength of the network that exists at the local level. We've done similar work showing that stronger networks over time are more effective in implementing policy change, getting things like stronger local tobacco control ordinances implemented, and achieving larger reductions in smoking and obesity, for example. We've done studies looking at the economic effects that are attributable to networks and shown, again, that places that over time build stronger networks see lower growth in medical spending using Medicare data specifically. So there are important economic effects that we can attribute back to the strength of networks. And as well as the equity dimension to these networks as well. We've shown that places that build stronger networks over time have actually achieved, have narrowed the disparity, the income-related disparity in life expectancy in these communities over time as well. We see significant gains in life expectancy among the lower income populations, resulting in a narrowing in the life expectancy gap between high income and low income populations. So these are just some of the ways in which we've used these same data and network metrics in combination with strong quasi-experimental methods with longitudinal data to study the effects and the consequences of changes in networks. So law enforcement specifically, I'm going to show you the measures of law enforcement network engagement we've constructed and taken a look at to date, with 4 basic measures that we look at that tell us the extent to which law enforcement, allow us to measure the extent to which law enforcement is engaged in multi-sector networks in working on health improvement activities. The first one we call the extensive margin of law enforcement engagement, borrowing a concept from economics. This basically measures the percent of communities in which law enforcement is engaged in at least one of the 20 recommended population health activities measured on the survey. So is there any law enforcement engagement in population health improvement activities in the community? Second is the intensive margin, or measures how intensively are law enforcement agencies working within these networks on health improvement activities. And there we're measuring the intensive margin based on the proportion of recommended activities in which law enforcement is involved in each community. So it gives us a measure of intensity. Third measure is a standard measure from network analysis. It's the measure of degree centrality, specifically looking at the law enforcement sector. And basically, this is a summary measure of how strongly connected law enforcement is to the other organizations in the network that are contributing to the recommended population health improvement activities. Larger numbers on network connectivity tell us that law enforcement is working with a larger array of organizations to implement a larger proportion of the activities measured on the survey. And then finally, the fourth measure we look at is a measure of tie strength, the strength of the connection between law enforcement and each of the other sectors that are measured on our survey. That network diagram I showed earlier, tie strength is a measure of the width of those lines connecting law enforcement with each of the other sectors. And again, that's scaled based on the portion of activities that are jointly contributed by law enforcement and each of the other sectors measured in our survey. So I'll next again show you some summary measures of each of these 4 measures of law enforcement engagement, and what we're learning about at least the extent of geographic variation across the country in law enforcement engagement in these networks. Okay, so the obligatory eye chart is next on this slide. This slide shows you overall means for each of the population, each of the 20 or actually 19 population health activities that are included on the survey. And what we're seeing are percentages here that are measuring the percent of communities in which law enforcement is reported to participate in implementing each of these population health activities in the community. So I've given you an overall national estimate in the first column, an estimate for urban communities in the second column, and an estimate for rural communities in the third column. So we can look and test for rural-urban differences in the types of health activities that law enforcement agencies are engaged in across the country. And a couple of things to note here, and these slides will be available for download if you want to take a closer look at these numbers, if you don't want to get your head quite so close to the screen here. A couple things to note. First of all, these are all relatively low proportions, and so for each of these activities, it's just a minority of communities where law enforcement is participating in each of these activities, and only a relatively small fraction of communities. The largest rate, the highest level of participation that we see across the activities occurs for activity number 3, which is an activity around investigating adverse health events. For that activity, about 27% of the communities nationally reported law enforcement agency engagement in implementing that core population health activity in their community. So only about a quarter of the U.S. communities having law enforcement. That's the highest level among the 19 activities in our survey. You can also see, if you look across the columns, we do see generally higher levels of engagement in urban communities compared to rural communities. And the rows where you see that double asterisk, those indicate differences in proportions that are statistically significant between urban and rural. So you see we have quite a number of activities where urban communities show higher levels of law enforcement engagement in the activity compared to rural communities. So those are the two major takeaways. Overall, relatively low levels of engagement in these activities, higher levels of engagement in urban compared to rural communities. But also, substantial variation across the individual activities as well, ranging from a high of 27% of communities have law enforcement engagement in adverse health events investigation, ranging down to just 4% of communities having law enforcement engaged in developing a resource allocation plan for implementing health improvement activities based on identified health needs. So quite a bit of variation across the individual activities. At the bottom, I've given you some of the summary measures, the intensive margin and extensive margin. That extensive margin row down there at the bottom tells us that overall, across the full national sample, law enforcement agencies are engaged in at least one of these activities in about 44% of U.S. communities. And that tells us that overall, law enforcement activities are engaged in these, in one or more of these activities in less than half of U.S. communities. Again, it's somewhat higher level of engagement in urban. About 55% of urban communities have law enforcement engagement, only about 36% of rural communities. So overall, relatively low levels of engagement of law enforcement engagement in these recommended health improvement activities as of 2018. That's our baseline year. To give you a little better sense about how much variation we're seeing in these measures, this slide is looking at two of our measures of law enforcement engagement: the measure of intensive margin, or how many of these activities do law enforcement agencies engage in the average community, and then that's on the left side of your screen. And then on the right side of your screen is the measure of degree centrality, basically how connected are law enforcement agencies to other organizations in the community that are implementing these activities. And these are classic box and whisker plots, so you can just see the extent of variation across communities in these two measures. I think that's the major takeaway from this slide is that while on average we see overall relatively low levels of law enforcement engagement, we also see pretty extensive variation across communities in the extent of engagement. And looking at that intensive margin on the left-hand side, again, on average, the average U.S. community law enforcement is engaged in less than 20% of these activities. But you can see, some of the outlier values up on the top of that slide. There are at least some communities where law enforcement are involved reportedly involved in implementing the vast majority of these recommended activities. At least one that's involved in 100% of the 20 activities measured on the survey, at least in urban areas. And we see that distribution is equally wide in the rural communities, but that whole distribution is shifted down considerably. This degree of variation is an important finding for us at this early exploratory stage, because again, it suggests that there's high degree of heterogeneity across communities in the extent to which law enforcement agencies are working with other community organizations around health improvement activities. And so that variation, that sets us up for some important continued research down the road in this, in this line, looking at what factors may explain this variation that we see in law enforcement engagement. And it also sets us up eventually for examining whether law enforcement engagement is influential in shaping, the practices and behaviors of law enforcement agencies. We've got lots of variation in engagement. We have at least the potential to examine whether that engagement translates into any influence on law enforcement agency behaviors and events over time. So this, at least for the purpose of research, this finding of wide variation is a beneficial thing for us in terms of having potentially the power and the opportunity to explore what factors drive this variation and to explore the consequences of this variation in terms of outcomes like incarceration or police-involved deaths. On the right-hand side, again, you see the same box and whisker plots, but looking at our measure of network connectivity, basically how connected are law enforcement agencies to other organizations in the community that are implementing these activities. Again, we see wide variation, not quite as much variation in network connectivity as we see in the percent of activities performed, but still a wide range, wide band of variation, and again, more variation in urban as compared to rural communities. Okay, I'm going to share with you one more slide of results, and then I'll wrap up and get some discussion going. Our fourth type of measure that we've examined at this stage, again, just in the early exploratory phase of this research, lets us look at what other organizations in the community are law enforcement agencies working with to implement these recommended health improvement activities in the community. And I've ordered these, so this is another eye chart. Apologies. You may have to get close to your screen, or feel free to download the slides if you want to take a closer look. Here we're measuring for each sector the extent of the strength of the connection between law enforcement and each of the other sectors that are measured in our survey. We order these from low to high. The sectors at the top are sectors that have a stronger connection to law enforcement in the average U.S. community in our survey, and as you get down to the bottom of the list, these are sectors that have a less strong connection, less connectivity to law enforcement in terms of implementing these health activities. If we look at what sectors are at the top, and again, I've also separated out by urban and rural. Urban on the right in the blue lines, rural on the left in the red lines. And you can see here, just by looking at the sectors that are up there at the top, the overall ordering of these sectors, from high to low connectivity, is pretty consistent between rural and urban jurisdictions. The magnitude of the connections, we still see that difference, about almost twice as high connectivity in the urban communities as compared to the rural communities. But looking at what sectors have the highest levels of connectivity to law enforcement for the purposes of implementing these health improvement activities include local public health. The local public health agency is right there at the top. Some of that may be, by virtue of our measurement strategy, by the fact that we're actually, it's local public health officials who are the respondents to our survey. So there may be partly a response bias here in why we see these highest levels of connectivity measured with local public health. And so that's not necessarily surprising to see that high level. But some of the other organizations, are even more interesting and perhaps less expected. Organizations working on veterans issues and serving veterans are have the second highest level of connectivity on average in our national survey. Hospitals have the third highest level of connectivity with law enforcement. Organizations working in land use, working with disabled populations, housing, are also in that top 5 or 6 organizations that are highest levels of connectivity with law enforcement. The ordering on the left-hand side, looking at rural, is a little bit different. You can see, rural agencies tend to have slightly higher, relatively higher levels of connectivity with state public health agencies, for example, than urban do. Higher levels of connectivity with agricultural organizations, not surprisingly, in rural areas as compared to urban. But overall, pretty consistent. But as you can see here, quite a lot of variation across these sectors in their levels of connectivity with law enforcement, moving from the top to the bottom of the list here. Okay, so this is early going here. This is work that we just have started in the last couple of weeks, and by taking a careful look at law enforcement. What we found so far, number one, wide variation across the country in law enforcement engagement in these local health networks. The extensive margin of engagement, or the portion of communities where law enforcement is involved in at least some of these activities, falls at kind of a moderate level compared to other sectors. The intensive margin, which measures the proportion of activities that law enforcement are engaged in, that is quite a bit lower than for law enforcement than for many of the other sectors that we measure on the survey, suggesting a couple of things. That one is there's lots of room for, if law enforcement engagement in these activities is a good and beneficial thing, which is an assumption at this stage, largely unproven. The relatively low levels of engagement that we see here suggest there's a lot of room for improvement. And so, in terms of opportunities for research and for potentially discovering pathways for improving the situation, that's certainly, there's ample room for experimentation and testing in terms of looking at ways of improving and strengthening law enforcement engagement with other organizations around health improvement activities. The other kind of big finding, I think, so far from this work is that we do see a large and systematic and significant difference between rural and urban settings in terms of the extent of law enforcement engagement in these activities. This is early days. We've got a number of plans for where we want to take this research going forward. Our next steps in this research is to begin to look at some of the community characteristics that may be associated with, and may help to explain the geographic variation in law enforcement engagement in these activities that we see across the country. How much of it is related to demographic or socioeconomic factors or organizational factors, like the characteristics and the capacities of law enforcement and public health and other sectors. As I mentioned, we're in the process of linking these data with local level data that tell us something about law enforcement behavior and actions, in particular data on incarceration rates and data on police involved deaths. And that will then allow us to explore whether the variation that we see in law enforcement engagement in these networks is any of that associated with incarceration or police-involved deaths in these communities, just as a starting point to see whether this variation is connected to two important outcomes that we can identify and measure at the community level. As I mentioned, we'll be going back in the field with the survey during the second half of this year, ramping things up for data collection next month. So by the end of the year, we'll have an additional time point, 2020 data, on these same measures of, again, law enforcement engagement in networks. And that will then allow us to explore longitudinal change in addition to geographic variation in these measures of law enforcement engagement. And in particular, that will give us a time points both before and early phases after the recent activities around protest as well as reform activities in law enforcement, to see if any of the recent actions around heightened public and policy attention to law enforcement culture and practice may be playing a role in shifting some of these relationships at the community level, and that hopefully will position us for again more work to come in terms of understanding these patterns. Okay, so I'm going to stop there. We've got a few minutes for some Q&A. And again, thanks for those of you who have used the Q&A box down at the bottom of your screen to type in questions. Let me see if I can get to some of these questions. So first question, this is a really good one. Question about what do we know about whether the data on connectivity between law enforcement and public health networks are harmful versus beneficial? And that's an excellent question. I think it's possible that both of those things could be true. Our initial thinking and hypothesis, kind of operating hypothesis, is that more connections might be beneficial particularly to law enforcement agencies if some of these other health and social service sectors can play a role in informing the culture and the practices of law enforcement agencies, and maybe generating greater sensitivity and awareness around health and safety and social justice issues in law enforcement. However, it's also true that this connectivity could be harmful in some ways. Law enforcement agencies right now, especially, do not enjoy high levels of public trust and faith, and so that some of that negative trust, negative perceptions of law enforcement have the potential to be transmitted to other organizations that may work with law enforcement around health improvement activities. That's a potential risk for public health agencies as well as other community organizations that may endeavor to partner and engage law enforcement in health improvement activities. So absolutely, there is the potential for harm to be generated through these kind of connections as well, and that's something that hopefully our data can offer some lens into as we continue to move ahead in this analysis. Thank you for that question. Question about the theoretical framework guiding this inquiry. Around how structural racism within institutions might be driving relationships, and how we can conceptualize and operationalize racism in the context of this study. I think that's an excellent question. I think the short answer is, I think our particular analysis with the opportunity, the data we have in hand to measure these issues really does not leave us in a very strong position for explicitly conceptualizing and measuring racism in how it may exist within the institutions that are measured in our survey. So that is something that we are not able to direct, at least to tackle explicitly with the data and methods that we have at hand. I would say that we may be able to look at some of these issues, at least indirectly, by linking our survey data, our network data up with measures of, again, some of the law enforcement outcomes that we are planning to examine as the next stage, looking at rates of incarceration, looking at rates of police-involved violence. If we could consider those measures give us some lens into at least unequal treatment and inequitable practices among law enforcement, that's a pathway for us to at least examine some of these dynamics indirectly. I don't think our data by themselves are not sufficient really for examining those constructs in any level of depth. But there's certainly maybe other studies and other ways of tackling those issues. Excellent question. Question about what is considered engagement? How do we operationalize that? In the context of our survey, we look at engagement, we measure engagement using a very functional definition. Based on our survey, we define engagement as existing when a pair of organizations are both reported to contribute to the same activity as measured in our survey. So it's a very functional definition of engagement. We are not able to examine to any extent the quality of that engagement or with any granularity the nature of that engagement. Engagement is simply defined as being, we have a pair of organizations that are both jointly contributing to the implementation of a recommended population health activity in our survey. So it's a pretty crude measure of engagement. That's the trade-off we accept in order to be able to collect that measure on hundreds of communities over time, is that we have to sacrifice some granularity, quite a bit of granularity, in fact, on that front. I know we are running low on time. Let me see if I can just, there are lots of good questions about sharing specific examples of opportunities and constraints around engagement and collaboration, which are fantastic here. I would just say, the nature of survey research and kind of our opportunity to study these issues are at a much higher level than what we might like to be able to learn by looking at specific examples of engagement or lack thereof in specific communities and contexts. Certainly, so I think we have to keep in mind the limits of survey research. We can learn things about broad patterns and trends that are occurring across the country, but what we miss is the granularity about the nature, the quality, and intensity of activities as they're playing out around the country. So we need other studies, including qualitative and mixed method studies, to kind of join us in this endeavor and help us to learn more about the interface between law enforcement public health and the social services arena. So I know we were out of time, so I'm going to stop here. And Chris, you want to say a few closing remarks?
Yeah, thank you so much, Dr. Mays, for the presentation. We just want to let everybody know that we will be sharing these slides with you all, and also a recording of the webinar. You can check out this webinar and others on our website, systemsforaction.org. Be sure to follow us on Twitter and look forward to our next upcoming webinar, July 8th. We will be hearing from a new study of ours that's looking at the aligning health and social systems to expand evidence-based home visiting. So we look forward to seeing you then. And if you have any, if you'd like to have a certificate of participation, please reach out to us once we follow up with an email. So thank you all for attending, and thank you, Glenn, for presenting. We'll see you all July